Julia Paredes was only 17, a young girl with dreams and aspirations like any other teenager. She lived in Loreto, a small, close-knit town in Chihuahua, Mexico, where everyone knew each other and life was simple. One day, a devastating measles outbreak hit Loreto, shaking the very foundation of the community. It was bad, really bad. Kids were getting sick, and the hospital was overwhelmed. Some even died. Julia saw the pain in the eyes of the children and the fear in the faces of their families. It changed her deeply. She knew she had to do something. She couldn't just stand by and watch. That's when she made a life-changing decision. She would become a nurse. Julia dedicated herself to her studies, driven by the desire to help those in need. She trained tirelessly, learning everything she could about medicine and patient care. Her determination and compassion would shape her future and the lives of many she would go on to help. Becoming a nurse wasn't easy, especially in Chihuahua. It's big, like really big, and lots of towns are remote, hidden in the mountains, hard to reach. But Julia was determined. She traveled for days, sometimes on foot, carrying precious cargo vaccines. She went to every corner of Chihuahua, bringing help to the most vulnerable. Julia's dedication didn't go unnoticed. She became the state supervisor for Chihuahua's universal vaccination program, basically the vaccine general. Her mission? Vaccinate every single child in Chihuahua. No exceptions. She trained nurses, organized campaigns. She was unstoppable. Under her leadership, vaccination rates soared. Julia was making a real difference. Section 4. Battling Fear. The polio scare of '91. In 1991, panic hit the nation like a storm. Polio. A word that struck fear into the hearts of parents everywhere. Parents were scared. They refused to vaccinate their children, fearing the unknown more than the disease itself. Julia, a dedicated nurse, knew she had to act fast to prevent a disaster. This wasn't just about logistics or medical supplies. It was about trust and communication. She went on the radio, using the airwaves to reach as many people as possible, spoke at town halls. She talked to parents directly, addressing their fears and concerns head-on, explained the importance of vaccines, how they could save their children's lives. Slowly but surely, she calmed their fears, one conversation at a time. The vaccination program was back on track, and the community breathed a collective sigh of relief. Thanks to Julia's relentless efforts, the town was safe once more, and the children could play without fear. Section 5. A legacy of health more than just a thermos. This is not just an ordinary container. It is a symbol of hope, a beacon of life, and a testament to the dedication of countless healthcare workers. Julia Paredes dedicated her life to protecting children. She traveled to the most remote areas, ensuring that every child had access to life-saving vaccines. Her commitment knew no bounds. She is a true hero. Her smile brought comfort to many, and her unwavering dedication inspired those around her. Julia's work was not just a job, it was her calling. She once said, "That vaccine thermos is more than just a container. It carries hope. It carries life." Julia's legacy lives on in every vaccine administered, in every life saved, in the countless lives she saved. Her efforts have led to healthier communities, where children can play, learn, and grow without the fear of preventable diseases. In the health of a generation, her work has ensured that children can attend school, dream big, and achieve their potential. The ripple effect of her dedication is immeasurable. She showed us the power of one person, the power of compassion. Julia's journey through rugged terrains and challenging conditions is a testament to her resilience and love for humanity. The power of a vaccine. It is not just a medical intervention, it is a promise of a healthier future. Julia Paredes' legacy reminds us that with dedication and compassion, we can change the world, one vaccine at a time.